Welcome everybody, thanks for joining our webinar tonight. I'll give us a second here for everyone to get logged in. Looks like we've got a good amount of attendees, so thank you for being here. And I think I'm going to go ahead and get us started. So welcome to our third webinar this month, actually, which is kind of a lot. I appreciate everyone who has been here for all of these and stuck through with us. It's nice to have you here, and we appreciate that you are interested in learning about these issues. I'm Laura Ellsworth. I'm a Strategic Partnerships Manager for Council for the Homeless. And this particular webinar is a follow-up companion webinar to the one that we did 2 weeks ago with Mark Jones. And then, so before we begin, I know there might be some people here who are new to webinars, so I just want to go over a few housekeeping items. Number one, you're all muted and your video is turned off. The only people that you can see and hear are the presenters and myself. That orange arrow that will show or hide your control panel. And we will have some time for audience questions a bit later, so please feel free to ask questions in the questions function of your control panel. And this webinar is being recorded and we'll share it out afterwards, and we also will put it on our website along with all of our previous webinars. So I want to call just a little bit more attention to that control panel. For those of you who are viewing on your computer, knowing how to use this will actually make a big difference in your experience tonight. So for those of you who are just calling in, it doesn't apply, but that control panel, again, it's that little box to the right of your screen, and you can move it wherever you would like for viewing. And again, take note of that questions section. That's where you could submit questions, and I'll try to get to as many as we can during the Q&A portion after our speakers tonight. And then as we get started, I want to just put out some group agreements to keep in mind. Many of us aren't used to viewing the world through a racial lens, and it often feels uncomfortable and can lack a sense of closure. And I want you to know that discomfort is okay. It means we're doing something worth doing. You will be hearing some real life stories from people tonight, and I ask that we all stay engaged, listen to understand, and speak our truth in a responsible way. So tonight is all about storytelling. You're going to hear real stories from people of color who live and work in our community and who serve people who experience homelessness, housing instability, and housing injustice, many of whom are disproportionately people of color. Our goal for tonight is to tell stories to help people learn about the obstacles our BIPOC community has around housing and homelessness. We're thrilled to have a panel of speakers tonight who work within their personal and professional lives to serve our most vulnerable people. So for those of you who watched our webinar with Mark Jones, he talked about how by only knowing just a few things about a person, that they could predict when someone would die. And that may have sounded a bit startling, but this concept is known as social determinants of health. So take a look here at this graphic from Clark County's website. Health is influenced by so much more than what happens at our doctor's office. Housing, access to systems of care, education, healthy food, isolation, something that we're all becoming very familiar with during these COVID times, hunger, education, transportation, income, and work. All of these things impact a person's health. I also thought I would show you a couple of samples of social determinants of health as they relate to housing and homelessness and zip code. Safe and secure housing is a critical factor in achieving good health. Where we can afford to live impacts our quality of life because the location of a neighborhood can make it easier or harder to get a quality education and earn good wages, access nutritious foods, and enjoy physically active lifestyles. When individuals and families have to spend a large portion of their income on rent or mortgage, it leaves little to pay for other necessities like food, healthcare, and transportation. Many who can't afford the cost of housing are forced to double up with friends and family or may experience homelessness. So you can see here on this slide which zip codes in Clark County have a higher rate of rent-burdened households. The darker the teal, the higher the concentration of households spending more than 30% of their income on rent. Now take a look at these maps that indicate the level of homelessness among students of different ages throughout Clark County. So again, the darker the teal, the higher the rate of homelessness. Do you see some parallels with the rent burden map that you just saw? How about similarities and differences between elementary versus middle school versus high school? So you can kind of see there's some interesting parallels there. Another thing that Mark talked about was his work with the Spark study. So I've uploaded this study as a handout tonight, and I encourage you to download it and take a closer look. This work has influenced investments into programs at a local level, which I will go more into in a second. In September of 2016, the Center for Social Initiative launched SPARK, which stands for Supporting Partnerships for Anti-Racist Communities to Understand and Respond to Racial Inequities and Homelessness. The team analyzed over 110,000 individual records of people from HMIS in the SPARK partner communities between 2013 and 2015. They administered a provider workforce demographic survey. They collected 148 oral histories of people of color experiencing homelessness and conducted 18 focus groups in 6 different communities across the United States. And through this research and action in 6 communities, SPARK has begun a national conversation about racial equity in the homelessness sector. And although Black people comprise 13% of the general population in the United States and 26% of those living in poverty, they account for more than 40% of the homeless population, suggesting that poverty rates alone do not explain the overrepresentation. So according to our 2019 HMIS system numbers, the SPARK study key findings are also reflected right here in Clark County. The dotted lines illustrate the likelihood of the average person experiencing homelessness, the dark purple line, and the average person experiencing poverty, the light purple line. So for each group, the higher above the dotted line, the higher the disparity and the greater the vulnerability. So white people are slightly less likely than average to experience homelessness and less likely than average to experience poverty. Black people are more likely to experience both poverty and homelessness than average, along with Pacific Islanders, Indigenous people, Latinx, and Asian communities. This document is also included tonight as a handout, so please do download it and take a closer look. So the SPARK research team came up with some recommendations. The recommendations presented are ambitious and structural in nature to respond to the underlying systemic inequities that have for decades put people of color at greater risk for experiencing homelessness. Some of the recommendations here are immediate and others are much longer term. Some are local, some are national. One of the ways this is translated into our work at Council for the Homeless is through our FACE program. Shortly after the SPARK study came out, Council for the Homeless began a program called FACE, Family Assistance and Community Engagement. And I mentioned storytelling at the beginning of our webinar. So these stories have been shared tonight from my colleague at Council for the Homeless who serves clients funded through the FACE program. I'm going to read them to you, and I'd like to ask that we all just take a step back and really hear these experiences. These stories illustrate why we have to center our services through culturally specific and equity lenses. So when Juanita first contacted Council for the Homeless, she was terrified of asking for help and only agreed to meet with staff at the strong encouragement of her trusted school. Juanita and her family were currently being evicted from her apartment and owed over $10,000 to her landlord. The landlord had asked the family to do work around the apartment complex to cover their monthly rent costs, but then didn't apply their labor to their rent. And when the family asked for their rent to be reduced to cover their labor, the landlord threatened to call ICE on the family and put an eviction notice on their door for the full amount of the rent due. Due to fear of the court system, Juanita and her family did not feel comfortable fighting the eviction in court and ended up moving out of the apartment and into their car. Working with Council for the Homeless staff, Juanita and her family were able to pay off the debt and found a landlord willing to work with them to get back into housing. Luna was living in her car with her daughter and partner when she first reached out to Council for the Homeless for support. Luna had 2 jobs and just needed support in finding an apartment she could afford. With staff support, she was quickly approved for an apartment. Luna worked as an exotic dancer and depended on that income to meet her needs. During the approval process, while Luna was signing paperwork with her new landlord, the landlord asked her to sign a form stating that she would no longer dance for income. And feeling extreme pressure from the landlord, she ended up signing the form. In addition to being asked to sign this form, Luna's partner, who is transgender, was not put onto the lease despite Luna's requests and was told he was only able to visit for a maximum of 2 weeks at a time. Luna felt she did not have the ability to safely advocate for herself. Okay, so now's the time to hear from our panelists who are here to share some of their experiences and stories from real people here in Clark County. I'd like to introduce you first to our first panelist tonight, Tanisha Harris. Tanisha was born and raised in Vancouver and has spent the last 10 years working for the Evergreen School District in the field, or has spent 10 years working for the Evergreen School District in the field of multicultural and diversity education, both at Heritage High School and at the district office. And she now works as a CASA program specialist for the YWCA of Clark County, where she advocates for children in the dependency foster care system and supervises CASA volunteers. So Tanisha, Mark talked about centering the voices most impacted by an issue, and that when they tell you what they need to believe them. Can you share some examples of structural racism challenges and real life effects, especially in your work and for the people that you advocate on behalf of?
Yes. Thank you, Laura, and thank you, Council for the Homeless, for this webinar series. I had a chance to watch what Mark was talking about, and my line of work is very interesting. We're advocating for families in the foster care system, and when we talk about families, we're talking about families who are in crisis. We are talking about families in extreme need of not just housing, but services maybe relating to prevention of domestic violence, services around educational support, services around substance and addiction abuse issues as well too. So when we look at what is happening to our families, housing is just one piece of the puzzle, but really to understand systemic racism and how it can affect those families, I'm looking really at what's happening in our foster care system. And I'm grateful for Laura for sharing this, some information and kind of put in perspective some of the families I'm going to talk about this evening. And this is some information that we as CASA stands for Court Appointed Special Advocate at the YWCA, who we advocate for in terms of demographics. So this is our 2019 numbers. So we advocated for 736 kids in the foster care system. 2% of them were Asian or Pacific Islander. 6% were Black or African American. 14% of them were Hispanic or Latino and Latinx, and then 61% were white. We also have 2 other categories that are missing because we have some incomplete data, and that's on our kids who are multiracial and our Native American, Native Alaskan children as well too. So I have those numbers, and now I'm going to share with you the Clark County population. As you can see, 4.9% Asian, 2.3% Black, 10% Hispanic, and 78% white. And there's about 5% that still makes up multiracial and Native American. These numbers, I like to share it with people because we're talking about disproportionality of families of color in our foster care system versus the actual population. And so when we are talking about housing, security and instability within the foster care system, it affects our families of color more than it does white families. And so for me, when I am advocating, where we are advocating for our families, we have a best interest advocacy model that we use, and that is learn, engage, recommend, collaborate, and report. And I think that is similar to probably what the Council of the Homeless and some other models that both probably Terrell and Diana use as well in their line of work each and every single day. Like I said, with our families, they're in crisis. And the families that we are working with are low to no income, receive some sort of state assistance or federal assistance. But the main thing is they need stable, secure, and safe housing. And I stress safe housing because a lot of times that our families, especially who experience physical abuse, sexual abuse, and domestic violence, they need to, in order to have a successful reunification, we need to have them in secure, stable, and safe housing. And a lot of times our families have to find a whole new living environment. So make sure that they are safe and they are secure too. Our parents who have substance abuse issues, it's a matter of a clean and sober living lifestyle and environment and a support system too. You can see how everything kind of connects to get together. And for me, the families I work with, a lot of times that last barrier, that last piece to reunification is the housing piece. So having affordable, accessible housing for our families' needs is extremely important. I work with a number of families that when they come into the foster care system, they owe back rent. They find themselves, once if their kids are removed from their care, child support gets taken from whatever income they may have and is applied towards the state for foster care. And so we're dealing now with a lack of income for our parents too. And then also the services that are asked of our parents to do. In addition to, a lot of times our kids have services as well that are provided to them. So when working with families, it's always about keeping the kids safe where their home is currently. If they are placed with their parents, we want to keep the family safe. Another thing that we always take in consideration is the school or school district that the kids were attending prior to coming to the foster care system. Is connected back into that support system. The schools that those kids are attending, that is their family. That is essentially their family, and what provides them security and safety during the school day as well too. So when we are going through a course of a case, we will have families or parents who may move 2 or 3 different times because they're trying to find something that's affordable, something that they can pay rent month to month. They want to be in the school district or the school boundaries where their kids were going to school at, because they know that provides security and safety for their kids. And there's a safety network there within the school system too. So we have parents who a lot of times will go through the system trying to find housing as their main thing. They can do their services, they can get clean and sober, but it goes back to that affordable housing piece and where in Clark County are we looking at too. And I appreciate, Laura, you showing that map earlier about the different zip codes and poverty too, because those zip codes are very reflective of the kids who we serve in the foster care system. We do work with, and through CASA, we do work with different housing agencies, Second Step Housing. We work with Council for the Homeless to find a housing assistance for our families. And a lot of our families do receive housing vouchers, but they not always are enough. And because that goes to the lack of affordable housing again, not just for our families who are in the foster care system, but for our low income families and for our families who are living paycheck to paycheck. We know that at any given time, people can lose their homes, their rents get raised if they're living in an apartment. So really, access to affordable housing is the key to a lot of times our families being successful and a successful reunification as well. I think of A lot of our families will start off living in clean and sober living. We have open house ministries, the Oxford House system that we work with too. And then some of our families are able to afford an apartment of their own with assistance, or they're living with family or friends too. But everybody does want a home of their own, of some kind. That's always the goal. They
Yeah.
want to have their own home. And so, working with our families, it's really about that best interest advocacy model. It's making sure that the assistance and resources are there. And the kids we work with are ages birth through 12 years old primarily too. So there's a lot of things that go into the families that we work with. And I know Terrell works with the older youth, kind of, kind of coming in after what the work that we do as well too. So I appreciate being able to share those statistics and seeing how the foster care system disproportionately affects our families of color. And you can imagine now with some of those statistics you showed about housing, how even housing security is even more critical and a barrier to our families of color within the foster care system.
Thank you. Well, I think I might anticipate your answer on this one based on what you've been sharing with us, but what do you think is one thing that needs to change so that we can improve things?
I would say, and this is probably my work with families and working within the community, is that we need an ample supply of affordable housing to meet our families' needs, no matter what income you are at. Um, that is what I have seen over and over again, is a lack of affordable housing. And that is realistically some of these rent prices that we have. Let's just, we could talk about homes, but let's talk about rental prices, rental of homes and apartment living. These prices sometimes are just so out of control and unrealistic. And especially when you have wage gaps and we have income inequality, which is a whole nother topic for us we can talk about too. It makes it so hard for our families to find that safe, affordable, and secure housing too. So we need better access and supply of affordable housing to meet our families' needs.
Yeah. Well, thank you so much for being here and for sharing with us tonight. Now I'm going to go to Terrell. So Terrell Berry is a housing case manager for Janus Youth Programs. He provides intensive case management to youth ages 18 to 24 in Clark County with rapid rehousing, permanent supportive housing, and homeless prevention. Terrell, you work with youth experiencing homelessness. Can you share some examples of how you've seen structural racism challenges and real life impacts with the folks that you serve?
I mean, yes. I want to start off by saying, these systems, like people often say systems are broken, but this system is actually working the way it's supposed to, unfortunately. As far as the criminal justice system, the child welfare system, education, and all that. So it's just I just want to start off with that. But I've seen this with our clients, like as far as trying to get even trying to get into the first step of getting housing is calling landlords and apartment managers and things like that. So straight off the bat, like we typically, like at my agency, we typically tell folks to make calls on their own. And so when they're making these calls, they're getting told misinformation and often illegal information, as far as like, oh well, you have this, so you can't rent here because you have a Section 8 voucher, or you have this certain type of assistance, or you have criminal history, that's an automatic no, and or you have an eviction, that's automatic no. So those, just knowing that is very unfortunate to me, because then I have to step in as a case manager and explain, like, this is against the law, you can't say that. But a lot of folks, a lot of young folks, a lot of folks, period, are not afforded that information or that type of advocate. So just knowing that they're going through that, and just seeing just seeing that, like, the criminal history is often looked at as an automatic no, but it's not. They're not being able to explain that. And as we know, black and other people of color are disproportionately in the criminal justice system. So
Yeah.
this is just a circular thing going on with the criminal justice system and evictions and things like that. I mean, so
Yeah.
I think just seeing that as an example is just one way of seeing how the systems affect folks in everyday life. Because if you can't find a stable home, you're not able to functionally work. If you can't find a job, you can't pay for rent.
Right.
So it's off and on. It's on and on. And then the access to clients getting IDs is hard too. I mean, because you got to have certain documents, standalone documents, stand-by documents, and all those documents. So it's hard, especially for our kids that are in the foster care system too.
Yeah, how many of our house people, have our birth certificates handy even, half the time we're forgetting where we're putting that stuff, and when you need it, you have to find it. But if you're a youth who's been in foster care or experiencing homelessness and, in crisis, I would imagine to get that stuff, it's really difficult to have that documentation.
Yeah, and I've seen the differences in I guess I would say policy, or I'm not for sure, but the different ways of interacting with youth. So like I'll bring a white youth, and they'll say, I got this, I don't have this, I don't have that, but I do, They'll be able to get ID real quick. But if I bring one of my clients of color, I've seen that it'll be like, oh well, you need this document, you need the first piece of paper you colored on as a kid and all that, So it's a lot. It's a bunch of jumps and hoops that folks have to go through.
Mm-hmm. What do you see anything happening that with your people that you work with that people assume aren't happening anymore? Like that
just the attitude and the words and the reason for denials. Like the fact that I had a landlord call one of my clients and like, oh, there's just a bunch of thugs over there. I was like, no, she's actually college educated and she has a job here and all that. So just knowing that that's still an attitude, like anti-blackness is still going on. Like just because we had a president that was black, and we've had certain milestones kept, but that doesn't change the fact that people are still using these biases to inform their decisions.
Yeah. Well, how about you? What is one thing that you think can change in order to improve things?
Huh. I mean, that's hard. That's hard because there's a lot of things that need to be done. I mean, as the words of, I forgot the guy's name, but he said the rent is too damn high. So we need to have a way to have affordable housing for everyone because, and I think recognition also, just understanding that it is systematic racism because I don't know the lady name. I don't want to say the lady name, but there's a Clark County representative that said, I don't think structural racism exists in this county. I was like, what? So just hearing that, I mean, there needs to be acknowledgement and understanding and ways to work towards that. Yeah. So I think there needs to be a real understanding of it, so work can be done. Because when you have higher ups that say that, not just her, you have other people that's in office, in higher offices that say worse. So yeah, I think it's just acknowledgement of it and working towards building that.
Yeah. Thank you. Yeah. I appreciate that that insight. Thank you. All right. Now I'd like to introduce you to Diana Avalos-Leos. Diana has the distinction of being named First Citizen of Clark County. She is the Executive Director of the Clark County Latino Youth Leadership Programs and recently began working with the Washington State Department of Health as a health services consultant with the Division of Prevention and Community Health on COVID-19. So Diana, for you, can you share one of the things actually that Mark talked about in our last webinar was about centering the voices that are most impacted by an issue. So what do you see in your work and the people that you advocate on behalf of around this issue of how racism intersects with housing, homelessness, housing justice?
So thank you so much, Laura, for that introduction. I always like cringe introductions, I'm going to share the work that has been very close and dear to my heart, and that is with our undocumented youth. Undocumented youth, when I say undocumented youth, these are young people in our community, young people across our country who, of no fault of their own, were brought to this country and have yet to gain legal status and live in the shadows. So being an undocumented youth here in Southwest Washington is no different than being an undocumented youth in this country, anywhere in this country. Undocumented youth often, more than often, come with barriers that impede their ability to thrive or to live life without that constant fear. In 2016, when with the election of this current person, we all saw an uprise of violent political rhetoric against immigrants and undocumented populations in this country. And we in Clark County in Southwest Washington, we were not immune to that hate. The constant threat of terminating DACA, the Deferred Action for Childhood Arrivals, and temporary protection status programs created even more instability and fear and uncertainty for an undocumented youth. The safety of many undocumented youth and their families, they're living on the edge. They live in the shadows, constant fear that because one family member is undocumented, but another family member is a legal U.S. resident or is a U.S. citizen born person, what we call is identified as mixed status families, is still not enough to live free in this country, as I know it, and as many of us on this call know to experience what is to be free in this country. So back in 2016, according to the Pew Research Institute, there was an article that about 10.7 million undocumented immigrants live in the US, which is about 3.3 of the overall population of this country. And as of 2016, about 5 million children have at least one undocumented parent living in the United States. So what that means is that any household, their two-parent household, one parent is undocumented, the other parent is of legal status or a U.S. citizen born, and one or more of the children are undocumented and or could be or are U.S. born citizens. So again, the word of mixed status families. So according to the U.S. Department of Education back in 2015, 65,000 undocumented students graduated high school every year. And only around between the range of 5 to 10% pursue a college degree, and less than 1% have a graduate degree. Less than 1% have a graduate degree. So the rate of undocumented students decreased dramatically as you go higher up in education. But for the purposes of this conversation, it is critical to also consider the effects of systemic racism. And the effect of systemic racism on communities of color has shown to foster, and we all know, we on this call have heard, and our content experts, some of us are, in terms of, have shown that systemic racism has been shown to foster poor health conditions by creating poor social living conditions. We know this, we see it, we hear it firsthand right here in Clark County. It's hard. This is incredible hard work and sad to see so much pain and so much hurt and so much fear in our community. As a result of systemic racism, at the individual level, when we're talking about undocumented youth, at the individual level is the internalization of racism. So more specifically, often undocumented youth often internalize a sense of less than. They're not worthy of, not feeling accepted. Often at times experience being oppressed by their peers who may not know that they are undocumented. And at times, whether intentionally or unintentionally, the microaggressions and behaviors of educators and people, professionals who serve undocumented families and youth in our communities, which again is not just happening in our community, it's happening across the nation. So an additional issue facing undocumented youth are the psychological repercussions of living in the shadows. In other words, having to deal with the daily stressors of hiding your undocumented status, hiding that status from a landlord, hiding that status from a mortgage lender, hiding that status from access to resources and support in the community. And so when social service agencies who are providing those direct services unintentionally ask, oh, do you have a driver's license? Or do you have an ID? Oh, we need a social. Barriers, right? And we see it over and over again. Now, I will say, we are getting a little better in Clark County because it's voices like myself, it's voices like the Diana Perez, it's voices like Ed Hamilton, it is voices like Luz Gonzalez, and I can go on and on. These warriors in community, Tanisha, Terrell, and many others, that we don't stay quiet. We amplify our voice and in a respectful way help others to understand that the very policies that you are creating to serve communities are the same policies that are inhibiting access and creating this systemic racism that quote unquote does not exist in Clark County.
I'm glad you mentioned policy because as we close out tonight, I have some policy recommendations to share from that Spark study. So do you have any, what are your thoughts around at least one thing that we can change so that we can improve things here in Clark County?
If I had a magic wand, there'd be several things that kind of happen concurrently, right? One is workforce development opportunities. Mm-hmm. Another is addressing policies that not only impact undocumented youth, that impact communities of color. Because regardless of status, communities of color unfortunately share a lot of the same challenges and are faced with the same needs and have the same disparities, and we have to mitigate through all of the chaos. And as one of my good friends, Dr. Anthony Kelly, navigate the funk. Right? So the critical need for policy change, the critical need to understand how to create policy change through a developed equity, diversity, inclusion, and social justice lens. And not lean into, well, they come from a large organization, so they should know about DEI work. No, I'm going to push back on that, because none of us, I'm not calling out, I'm going to put myself in this equation. I am not an expert in diversity, equity, and inclusion and social justice. And this work cannot be done in isolation or assume. It has to be done in a collective manner, in a collaborative approach. So that would be my dream. So thank you.
All right, thank you. Okay, so we have some time for some Q&A from the audience. Does anyone have any questions they'd like to ask any of our panelists tonight? I'll kind of monitor the questions box here. Right now, I don't see any, so I'll give it maybe a minute and see if any crop in there. And then maybe we can just do a little more chatting if we have some time for that. All right, so one question that's come in is, we all know that this is a really tough time with everything that's going on. How do you all practice self-care right now?
I mean,
Not everyone at once.
I can go. I could jump in here. So I think self-care looks differently for all of us, and I think that we need to be mindful of, one person's self-care is different than others, and being mindful that self-care just looks differently. And so for me, it looks differently all the time. It's taking breaks in the middle of the day and taking walks. It's unplugging on the weekends. It's spending time with family when I can in a safe way. It is eating right, taking care of yourself. One of my mantras is, if I can't take care of others if I don't know how to take care of myself.
I think for me, for so many different reasons at the moment too, just with my work, but really putting yourself on a schedule during the day, being intentional with your time, being able to say no at times too, because right now working with our foster care youth and our families, we have the issues of school, the hybrid learning programs, online learning, and want to be supportive of what's happening at our schools and with our kids. And in our caseloads too, a number of our kids are in special education at IEPs 504. So it's really having to be intentional with your time and knowing that you can only do so much during the day too. So it's critical that you put yourself on a good schedule too. I personally I turn off all electronics by 8 o'clock, and I try to be in bed by 9 o'clock. You just need to tune everything out and give your time to relax. I know I should be probably doing more, but really that's what's helping me right now. And because I am also, I supervise my CASA volunteers too. So like I said, being intentional with your time, working your own cases, but also being there for other people in your life, both personally and professionally.
Yeah, thank you.
So for me, I will be honest. the past, my self-care regimen or routine has been very arbitrary, and like in terms of, oh, think of an oasis of going to Hawaii, or getting sitting on a park bench with a book, or something like that, something real Dawson Creekish. But I've learned is, like, right now, what I'm doing right now is setting boundaries, because that's one of my hardest things, is to say no. And being a young black male, it's like it's hard to set those certain boundaries, because you want to set those boundaries, but you also want to be available and seem punctual and seem flexible and all these things. So I'm just learning. I've been this last year and a half, I've learned how to just set those boundaries of saying no or saying maybe, or how important that is. Because right now I'm in school. I'm an intern at council. I work at Janus. I have a wife, and I have a 2-year-old that's turning 3 next week. So just I'm like in like 5 different sitcoms at once. So I have to put the DVR on sometimes, if you know what I
Yeah.
mean. So right now I'm setting those boundaries, but I'm looking for different ways to channel being grounded and being more in the moment. I think that's what I'm working on right now, is just looking for practices and ways to do that. So had to keep it
Yeah,
100 with you.
that's great. Yeah, yeah, definitely relatable. Okay, we've had some other questions come in. Let's see. One of the things I actually wanted to address tonight, and we just didn't really have enough time, was one of the things that Mark had talked about was the network impoverishment, and just how communities of color and culturally, the cultural differences. Oftentimes it's they're really, their finances are very stretched, because they're taking care of family members, and it doesn't mean that it's rooted in some sort of like poor decision making financially. It's really about that they don't have the banked money per se to withstand the crises that can put somebody into homelessness. And so did any of you resonate with that, and do you see that in your work?
Yes. Oh, sorry. I wanted to jump ahead, because I still deal with that personally. Because I'm in Washington, but my whole family's in California, different parts of Long Beach, Compton, Watts, and all that. So I still, just cultural reasons, I still feel obligated to help my family, and oftentimes that sometimes deal with me having, as my community says, robbing Peter to pay Paul sometimes. So I often deal with that, and I know a lot of clients that do. So it's hard. Since working doing homeless services for the last 3 years, I've been trying to figure out a solution for that, other than helping folks out financially, like some type of some kind of help for folks that's dealing with that, because like, unlike the Western civilization, most communities of color deal with it. They live in this mindset of, we're doing it all together. We're doing it as a community. Like, so whenever decisions I make, my family's in on it. Like, we have to come to collective thinking, So I don't know if I answered that, but that's that's it.
Absolutely, yeah.
I would say for me, my father is Black, and he's one of 7 kids. And I remember it was one time at a church event, and we have a large family the Harrises are, and other related families. And one of my cousins, who's around my dad's age, so she's like my 3rd or 4th cousin. But we have a big family, everybody's cousin. So, but she was telling me growing up that she said, all of us, we did not know we were poor. She goes, because we always had each other. She said, we had church, we had Sunday gatherings. She goes, people were always in and out of the house. Sometimes people would come to stay, other family members would come to stay and live. We had food on the table, we had clothes, we had shelter. She goes, it wasn't until the outside world and the pressures of society start telling you you don't have enough or you're not enough. She said, but she goes, we always had everything. And that's also something my dad has always instilled in us too. My dad and my mom are in a position that they too now can help everybody. But that's because that's something what you do. And in my family, it doesn't matter what your income, you're just always there to help out. And that maybe is a cultural thing too. But realistically, you know, that's a lot of our families of colors and our communities of color and how we live, and generational living as well too, many generations under the same house, the household. So, you know, for us, sometimes our distinct view of poverty or low income is very different just because of how we have come together throughout the decades and literally centuries of survival.
Mhm.
So.
Yeah. All right. Let's see here. Might have time for one more. For those of you that did see Mark's presentation, was there one thing particularly that was shared that you could relate to? Beyond what we just talked about?
You know, he started off his presentation about, I think it was, maybe I have the exact question wrong, but what is America? And envisioning, you know, what American can be, and, you know, kind of the history lesson of housing and where we're at now too. And, you know, before, you know, we started the webinar, you know, the four of us were speaking too. And this really goes into the work that all of us are doing, and not to get political, but what we do is on the ballot this year. What we do, the things that Diana talked about, what Terrell talked about when we're talking about policy around housing, around DACA, our undocumented citizens who are our families, they are our families, our homeless youth, they are our families. All these issues, and the work that the Council for the Homeless does too, and, you know, and our school systems, everything is on the ballot this year. So the importance of voting and how we move forward, and, you know, the work that Diana is doing with the, you know, Clark County Latino Network, you know, these things are all on the ballot, and our work intertwines with our lives, and that's why we do what we do.
Yeah, thank you. That's a good segue into some of our call to action items. So I'm going to move us along to that. And thank you, everyone, for the questions and the discussion. So I wanted to bring us back to that Spark Initiative study and just share some of their policy recommendations. You know, from a policy standpoint, solutions must be systemic, ambitious, and sustained. And these solutions require focused advocacy to shape political will and public support. So here are just a few recommendations. Implementing and enforcing existing fair housing protections with the full force of local, state, and federal government. And again, I want to say the full force of local, state, and federal government. I think Terrell shared a story about a lot of landlords advising things that aren't legal, you know, and then that's a person experiencing, you know, homelessness, who's young, trying to advocate for themselves, and their first pushback is maybe something that isn't legal. Develop new affordable housing stock through broader use of inclusionary zoning and mandatory affordable units for new developments. I mean, again, you've all touched on that need for affordable housing, and the fact that people who are very low income in our community can't afford to live here. Regulating evictions more closely. You know, again, this has become, you know, extremely abundantly clear during this last year with COVID, and we've done a couple of webinars on this. Introducing regulation or legislation to prevent speculators from conducting mass evictions or choosing not to renew leases of tenants. You know, we had something like that happen here locally a few years ago. And enacting some national tenants' rights legislation. Again, this is systemic, it's broad, it's ambitious, it takes political will. reintroducing rent control into large urban markets, enacting criminal justice system reform to reduce felony-related barriers to housing. Again, you know, I think Terrell touched on that, and Tanisha as well. You know, the fact that, you know, people get, you know, pay their debt to society, they need a place to live. It stabilizes the entire community when everyone has housing. Restructure the relationship between property value and funding for public works, including education, so that the opportunity for advancement in society is not tethered to neighborhood value. You know, this goes back to some of the things that Mark talked about around, you know, about how owning property built is, you know, the one thing that building wealth is tied to in our country, and you know, how communities of color, you know, and Black people particularly are, you know, there's been barriers for them to be able to do this. So again, that goes back to, you know, the system working exactly as it's been designed to do. So our reliable community call to action tonight, I want to leave you with, again, advocate for flexible funding. That, you know, that's, you know, that goes back to truly believing people when they tell you what they need. And, you know, at Council for the Homeless, we do this a lot through our diversion program. Sometimes, you know, people need a little bit of help, or sometimes they need a lot of help, but if we can have that flexible funding to listen to folks when they tell us what they need to get back on their feet, you know, that's a good place to start. You know, recognizing and addressing systemic racism. You know, if we're serious about ending homelessness, and I say this every time, we need to center our work in racial justice and equity. And, you know, vote. Tanisha mentioned this earlier. People experiencing homelessness can vote. People without an address can vote. We have same-day voter registration here in Clark County. People can go down to the elections office. If someone's experiencing homelessness and they don't have an address, they can just give an intersection near where they stay at night. So please, you know, encourage folks to vote. We have until November 3rd to do it. It's best to do it in, you know, if you need to register to go down to the elections office in person. If you have a mail-in ballot, it's best to fill it out and actually drop it off at a ballot box location as we're getting closer to the election. And, you know, this advocacy for increasing affordable housing, you know, it's never been more clear that housing is healthcare. So, you know, we can all do our part to bust those stigmas, to share data. We've been providing some data during these webinars through the handouts feature. Again, I encourage you to download those. You can also go to our website. We've got some dashboards. Those maps that I showed earlier with social determinants of health came from Clark County Public Health website, and they have a dashboard where you can kind of play around with different things and pull up information that you want to. And, you know, again, we always put it in there, continue to be a voice for change, be kind, and we really hope to see you again in November. Our next webinar will be November 19th, and it will be about equity in action. So that one we'll be sharing with you some things that we're doing both, I think, institutionally and client-centered in our work to approach serving people experiencing homelessness through an equity lens. So thanks everybody for attending tonight. Thank you to our panel so much. I appreciate you all very much for giving us your time tonight, and we'll look forward to seeing you all again in November. Thank you guys. Appreciate you.